name is Dr. Jan Einfeldt, and I'm a dentist working in Staples Dental Practice, a private practice in Kent, where I focus on orthodontics and restorative dentistry. Virtual Care 3.0 is a software where the patient takes pictures on their own smartphone. Those pictures are then assessed by an AI, an artificial intelligence, and the dentist, and will send notifications to the dentist if either the teeth are not tracking or if the patient is not compliant. Virtual Care 3.0 has evolved from more manual steps required to a now more automated and AI-assisted monitoring of the patient, where the dentist is in full control of when he thinks a case may require intervention. The benefits of Virtual Care 3.0 are, for me as a dentist, of a very close monitoring of the patient's progress, and I will also get alerts if there's any gaps developing between the aligner and the teeth by the artificial intelligence where I have set the parameters. And this also means that I have an amazing compliance measurement tool which gives me a very strong indication of where there may be a lack of compliance with a patient. It also helps me to monitor things like oral health. The benefits of Virtual Care 3.0 from the patient's perspective is that it reminds the patient and it gives them ownership and responsibility for the progress of their own case. So the part that the patient is responsible for, wearing the aligners, is encouraged by the weekly request for sharing pictures. So the compliance is actually encouraged this way. The benefit from our practice perspective is that it saves us in-clinic time and therefore saves us costs and resources without lowering the standard of care. As a business, this lets me focus on the patients that do require a practice visit and corrections. And our patients really appreciate that we are very respectful of their time, and the patients that are tracking well do not need to come to the practice. In the beginning, I only treated a few patients with virtual care, but very quickly I realized the potential and the benefits for both the patient, the dentist, and the practice, and very soon I started remote monitoring every single patient with virtual care. I tell the patient at the consultation stage that they will be remote monitored, and this helps with compliance, and it can reduce the treatment time for the patient and avoid extra costs due to low compliance. During the treatment, we can much closer monitor if any tracking issues occur. And it's almost funny that patients rarely ever tell us if they've lost an aligner. It's even happened to myself in my own treatment. I've lost an aligner, and patients rarely seem to call us and say, I've lost an aligner. But we can see it on the photo stages that they go 5, 6, 7, 8, 10. And suddenly there's a gap appearing between the aligner and the teeth. So we have an idea that they've probably lost an aligner somewhere, and that is of course due to the patient's compliance. When you treat that many patients with Invisalign simultaneously, it's very important that we know where to focus our time and efforts without reducing the standard of care. We want to focus our time and efforts on the patients that need assistance and not waste time for patients that are tracking well. I love the photo library that the virtual care creates, and it helps me to learn from my own cases and how I can reflect and learn from what went well and what would I change next time, especially when I'm also teaching dentists about aligner-based orthodontics. Virtual Care 3.0 integrates with the My Invisalign app and makes it easier to use with AI-guided photo capture instructions. The patient receives messages with guided information to comply and automated, or if required, tailored messages that we can set up as templates, or if the dentist wishes, he can write a fully individual response to the patient. These messages are sent to the patient via text and email. Yes, if I suddenly couldn't use Virtual Care 3.0, I would suddenly have to do a lot more manual steps. We would have to spend a lot more in-clinic time with the patient. It would reduce the efficiency for us, and we would not be able to treat as many patients as we are seeing right now. I can give you an example. I treated a young lady several years ago, way before Virtual Care was even available, and she wanted teeth straightening. But because she worked on a cruise ship, she was only able to come to our practice every 6 months. That meant that we couldn't do fixed braces for her, and she chose Invisalign. Now, we made sure that she was very, very compliant, and she knew that it was important that she wore her aligners 20 hours a day. And with that, we actually managed to treat her really well remotely, but we did not have any remote supervision. But that already opened my mind to the fact that you can actually treat patients with aligners without them coming to the practice so often. So her treatment was completed and she was happy with the outcome. Her case also wasn't the most complicated treatment, so I felt confident that we could still do that for her. A few years later, then the lady got married here in England and her mum came to visit. Now, her mum actually had some restorative requirements, but we realized that she actually needed teeth straightening for a better outcome before she could have restorative dentistry. Now, her mum lives in Zambia, and for her to go to a dentist, she needs to travel 2 full days by car to go and see a dentist in the capital. So she actually said she would prefer to have the treatment with us because she knew that her daughter had been treated remotely. And now that we had the virtual care, I could even treat her with more monitoring and more confidence, even though I can't see her on a regular basis. So we now have a patient in Zambia who is being remote monitored and will come back when she's finished all her aligners. So in summary, the fact that I now have virtual care remote monitoring allows me to treat patients remotely with a lot more confidence, and if there really was a tracking issue, we would find these issues much earlier and could also correct them much easier than when the patient has worn all their aligners and requires a much longer refinement. Thank you to FMC for letting us promote this virtual care on their platform, and thank you to Invisalign for pushing forward this technology, which I think is a key factor in making Invisalign treatment a lot more efficient.